It's open enrollment season and that time of year where most people are signing up for their annual health care coverage at work. But making the right choice for coverage is not always easy. In fact, some people are totally confused about what's best for them as individuals and for their family. Are you pulling your hair out as you sit down and try to sign up for your health care coverage at work? Was that your first time going through the process?
It was.
What was it like?
I don't even know what I signed up for.
22-year-old Melody Camaro is, like a lot of people in Metro Detroit, confused about open enrollment. If you're lucky, a company expert will walk you through your options. Scott Ethorn is a family physician with Ascension Providence. He's also the president and CEO of Together Health Network.
It really starts with understanding what your needs are. Whether as an individual, part of a family.
For Melody, she needs individual coverage and wants to know
My deductibles, my co-pays, what's best fits for me.
A lot of people are being offered high deductible plans today. More of the cost is passed on to employees. Ethorn says, consider 3 important things when picking your health care plan. Number 1, are you generally healthy and only go in for your annual checkup, preventive health services, or minor ailments? Number 2, do you anticipate a lot of expenses from surgery or if a family member has been ill?
If there are any conditions that are chronic conditions that might lead to more frequent care, you're really going to want to make sure that those services are covered.
And 3, consider your copay price.
Complexity of these plans is significant, and that's why it's so important to spend the time to really understand what those benefits are.
Other options: flexible spending versus health savings account. The first must be used within a year on qualifying expenses, whereas health savings?
Accounts that you can think of as a savings plan for the future.
The money rolls over year to year, and if you change jobs, it goes with you.
It's smart either way to save money and have money in the bank to cover health care costs. We know that it's a leading cause of personal bankruptcies.
Rachel Adams is 26 and works at a child care facility with no company health care. Her question?
What kind of health care is affordable but dependable?
There is a market exchange. Go to healthcare.gov, create an account. It will walk you through the steps for a variety of plans, bronze, silver, or gold, and decide what works for you. Sign up will end on December 15th. For those who really can't afford health insurance and land in the emergency room over and over again, help is available.
They may be services that are offered by a hospital or some other health provider in the spirit of a community health fair.
So for Melody and so many others, you're going through the process right now. That's exactly why we're doing this story. For sure. Still confused? If you're employed, your HR or benefits department should help you. Go ask. Online, of course, go to healthcare.gov, as we told you. And there are always community resources if you just can't afford health coverage. You can find all of this information and more at WXYZ.com. Dave?